So a few weeks ago, I was playing basketball and I injured my finger. It's on the left hand, but essentially what happened was this finger wouldn't retract back. It was like this. And it didn't hurt as much. It felt like a jammed finger. And so I wrapped it up and I went home and did some research. And this is what's called a mallet finger. What it is that your ligament tore at this point, and so it can't lift it up anymore in such a way. And in order to heal it, you need to keep it straight for about 6 to 8 weeks. Some people go up to like 12 weeks, however long to heal it, so that once it's straight again, then you can start rehabilitating it. So what I did when I went home, I went to a local drugstore, I think it was Walgreens, and I bought this aluminum type of finger splint and put it on my finger as such. And I used a micro porous tape to just kind of wrap it around. The problem with this one is, number one, it's very bulky and it feels very uncomfortable. Number two, when you wrap the tape around and you wash your hands, after a while your skin gets really kind of like develops some white patches. It isn't allowed to breathe as much, and your skin gets very irritated, and also gets a little bit smelly. So I used this for maybe a day or two, and then I went to the doctors. The doctors said it's a common injury and you have to keep it straight, like I explained. And he provided what's called a stax splint. It's a STAX. The way it's designed, if you can see, it holds your finger in place, allows your middle part to bend. So let me just try to demonstrate a little bit. And this is how you take a splint off. You make sure it's straight. You kind of slide it off as such. Okay, and then you just slide another splint in. And so you can see I can bend it in such a way, but then it won't allow my the upper mallet part, the upper knuckle, to bend, which is again what we want to keep it straight for the next again 6 to 12 weeks. And you can see it has built-in holes for your skin to breathe, and then you again wrap it around with this micro porous tape. However, I still feel that the skin gets very sensitive after washing it. It still feels kind of weird if you work in a job that you have to type. It doesn't really work well, and plus the sizing. The doctor didn't give me a couple sizes. Your finger will be swollen when you first sustain the injury, and so it'll be a little bit bigger, but then it'll grow smaller over time as well as it heals. Also, in different temperature, if it's cold, it'll shrink because the blood vessels are trying to keep your finger warm. In hot weather, it'll expand. It'll be a little bit bigger. So I wanted different sizes, but he said he only gave me one for whatever reasons. And also felt that after the 6-week period, I did play in between, and technically you're not supposed to. I use this as a good finger splint to go play basketball again. Again, the reason being is it's a very strong structure that prevents you from bending the knuckle where the mallet finger injury is. I just taped it a lot, and it worked fine with me. I don't recommend it. I recommend if you were to play, at least wait a few weeks. But if you really need to play, then go ahead and my personal opinion is use this stack splint at your own discretion. So the last splint, as I show here, is the Oval 8 splint, and I've been wearing it, and there's an example there. This is the best daily use splint I would recommend. Again, I'm pushing against the table, make sure that's straight, and then if you can see, there isn't as much coverage on your finger, but still prevents your mallet injury from bending. So that's what I like. You can wash your hands with it. It feels very comfortable. It's not bulky. And you can go on the next, again, 4 to 6 weeks without much of a hassle. Sometimes I don't even feel it's there. And this is a company called Oval 8. I found this on Amazon, and some kind of physical therapy company is selling these. And I do recommend getting like a chain of these Oval 8 splints, because you never know if you're going to sustain any other injuries on each finger. Again, I don't work for them, but the reason I say to buy this is very cost effective. This itself, this chain of all the sizes is about $33. And when I bought, initially first, I bought one oval 8 splint. It cost about $12. So essentially 3 separate one of these sizes will equal that one chain. Better to just invest your money in the chain of oval 8 splints, in my opinion. But this worked very well. In the forums, they said that if you were to remove your splint and let it hang, you might re-sustain the injury. I did it at the doctor's office. He kind of supported a little bit, so about the 3-week mark, it was kind of bent like this. But then now it's about 6 weeks, and I'm seeing a doctor in a couple of days. I actually have taken it off, or it slipped off on accident, but it's fairly straight now, and I'm pretty happy about it. So, but I still put it on there just in case. I might put there for a few more, weeks just to make sure it heals properly, or maybe start doing the rehabilitation part. But that's from my experience. The whole point of having this type of healing process is to avoid surgery. Because in the worst case scenario, if your finger doesn't heal and you let it just go be a mallet finger for a while, I think it'll heal in just such a way and you won't be able to lift it up anymore. And in order to rectify it, they would have to cut your finger open and stick a steel rod in there. And then after that, you would have a longer healing process. I'm trying to avoid that because I don't like surgeries. I don't like going to doctors in the first place. But if I can do this, my due diligence to heal this finger properly, I will do so. So I recommend, again, just for playing basketball if you want to, or the sport that you sustain your injury, if you want to continue. Just for daily usage, and don't buy this. Thanks.